Hi, welcome to another week of Practical Nutrition. I'm Cassie Dimick.
I'm Alex Shantz.
And I'm Sarah Kostelnik.
And we are so excited to have you here today. We are going to talk about COVID and modifiable risk factors. I know a lot of people probably are sick of hearing about COVID, but at this point we actually have some data out there that we can see more information about maybe what we can do if we get sick. And a lot of what we hear and a lot of what I'm hearing and you guys are probably hearing is about how we can minimize our risk of infection, with masking, hand washing, distancing, and vaccinations and all of those things, which while all of those things are great, we also want to talk about, because it is a virus, what do you do to help your outcome if you do get sick? And so that's what we're going to talk about today. And I really think there's a lot that we can do as a community and as individuals to really help our risk of not having serious illness by going into the hospital, not getting intubated, and not dying of COVID. And interestingly, there are some things that you can do to help decrease your risk. How much you're going to decrease your risk, we don't know yet, but we'll talk about a lot of that today. Just looking at what we do know, again, at this point, and we're still learning, but there was a systematic review and meta-analysis of 42 studies in almost 500,000 people that showed that kidney disease, COPD, diabetes, hypertension, cardiovascular disease, cancer, blood clots, male gender, older age, current smoker, and obesity are all risk factors for fatal outcomes with COVID. So you have a higher risk of dying if you have those things. Some of those, such as gender, like you guys out there, we can't do anything about that. Your age, can't do anything about that. So some things are not modifiable, but that doesn't mean that it's hopeless. So we'll really talk about those modifiable risk factors. And we mentioned a lot of those there, but we're going to really focus on type 2 diabetes, hypertension, obesity, and vitamin D deficiency and their role in COVID outcomes and what you can do to really minimize your risk. So Alex is going to get us started with just another general study.
Yes. So we're looking at non-communicable diseases. We're going to call that NCD because I don't want to say that 100 times. And COVID outcomes. So NCDs are diseases that are not passed from person to person. So unlike COVID or the flu, which is very contagious, thank you. I was like, what word am I looking for? Very contagious, thank you. It can be passed from person to person. NCDs are not. But they still have significant health effects and can lead to sickness and death. These diseases are usually due to lifestyle and genetics instead of acute infection. So how you live your lifestyle, exercising, healthy eating, all that kind of stuff. And include things like diabetes, cardiovascular disease, and chronic lung disease. So we always like that research. A cross-sectional study in Mexico looked at about 212,000 people confirmed with COVID and their risk for hospitalization, intubation, and death. 47% of the COVID cases had at least one NCD, and hypertension was the most prevalent. That's interesting. Mm-hmm. At least one NCD increased risk of death significantly compared to patients without an NCD. And again, those NCDs are non-communicable diseases. In order of severity of increased death risk, first is chronic kidney disease, which was highest, followed by diabetes, immunosuppression, obesity, hypertension, and COPD. The NCDs that most increased risk of ICU and intubation were diabetes, immunosuppression, and obesity. So very interesting.
Very interesting. So, we're starting to see these research studies that show that there is a correlation there between certain things and risk of dying from COVID. So very interesting. Yeah. So Sarah's going to talk a little bit about BMI.
Yes, and if you don't know what BMI is, we talked about that in another podcast.
I knew there'd be a plug there.
I know, right? So yes, remember your BMI is something to take with a grain of salt. However, it is appropriate for research purposes because it helps put people in a category based on their weight and their height. So when looking at a study that talked about BMI and COVID outcomes, there was a study in almost 5,000 people in the UK, and they found that BMI was strongly linked to increases in positive COVID tests and death, especially among those younger than 70 and of non-white ethnicities. And additionally, there was a meta-analysis and a review of over 3 million cases that showed that COVID patients with obesity had a significantly higher risk for death compared to those without obesity. And visceral fat, so you have different types of fat. Visceral fat is what we would consider more dangerous than subcutaneous fat. It's internal, it's deep fat, it's usually surrounding your vital organs. It has been shown to be an independent risk factor for severe COVID disease when compared to subcutaneous fat. So think about around your abdomen, that would be more of your visceral fat, whereas around your thighs, that would be more of your subcutaneous fat.
Yes, very interesting.
Yeah.
So what about diabetes?
Yes, so with diabetes and COVID outcomes, more research. There is a nationwide study in England with over 60 million people that showed that both type 1 and type 2 diabetes were independently associated with an increased death with COVID infection. And I know Cassie will probably say this too, but remember, this is just things that we're looking at that are connected. It's not saying people with diabetes are going to get COVID, or if you have diabetes, you're unhealthy, or whatever. It's just what the research is reflecting right now.
Yeah, they're finding associations.
Absolutely.
Yes, which is where we kind of start with research. Okay, there's an association here. Let's look at this in a deeper way, which again, we just haven't had the time to do that. So they're getting there. But that's a pretty big study of 60 million people. And so what they were really, in that study looking at was, is there a difference between type 1 and type 2? Type 2 is more of the modifiable, type 1 is not. And so it looked at that, and it did show that both of them actually were associated with higher risk, but we're going to talk about type 2 today. Just want to be clear about that. And now I'll talk about hypertension, and that's high blood pressure, but high blood pressure is the most common cardiovascular risk factor to show an association with a higher risk of death with COVID, and research has shown that it does. Also, vitamin D, and some of this has been in the news a little bit, but vitamin D deficiency is linked with an increased risk for hospitalization, ventilation, and death due to COVID. And very high, interesting too, very high vitamin D levels may increase COVID risk as well, and other upper respiratory tract issues. So I really am excited to talk to you guys a little bit about vitamin D today, because a lot of people hear that, okay, if your vitamin D is low, you have a higher risk of death or serious issues. So you just start dumping a bunch of vitamin D supplements in, and that may not be the best thing to do as well. I would say it wouldn't be the best, not may not, but we'll talk more about that. But there is definitely a link, and whether it's, sometimes you don't know if it's the cart before the horse, whether, you get sick and your vitamin D levels go down, or your vitamin D levels are down and it causes more of an issue. We don't know all of that yet, but there definitely is a link there. So now we're going to talk about what we can do about it. So we talked about what things that you might have going on that can increase your risk of death. But first, what can we do about it? And number one is to know your risk factors. Where are you with all of those things? Alex is going to talk about body weight.
Yes, it's important to know, are you at a healthy weight? What is your body fat percent? Again, that's something that you can know and that you can definitely modify to help decrease your risks. And do you have excessive visceral fat? So I know Sarah and Cassie already touched on that a little bit, but we're going to start with BMI, which Sarah said, take with a grain of salt. But again, it does categorize people and is appropriate for those type of setting. And to find BMI, it's that weight in kilos divided by your height in meters squared. And it'll put you in a range based on the output number that it gives. And 18.5 to 24.9 is that considered healthy range. 25 to 29.9 is considered overweight, and then 30 or higher is considered obese, and there's categories based off of that. So knowing where you fall in those categories can be important, especially with COVID. Also knowing your body fat percent, and that isn't going to be something that you could do on your own. We do 7-site skin folds here at AYB, so if you're curious to know generally where your body fat might be, you can come in and we could do that for you. There's other ways to do it, but that's a really quick and easy method to find your body fat. And for women, anywhere between 18 to 24% is considered healthy. 25 to 30% is considered acceptable. And then anything over 30%, again, considered obese. And then also what's important is where that fat's distributed. Is it around your abdomen, which that can have higher risk factors, where that visceral fat is located. So that's important to know as well. And then for men, 14 to 17% body fat is considered healthy, 18 to 25% is considered acceptable, and over 25% is considered obese. And then also an important risk factor to know is your waist circumference, which we touched on a little bit. And anything less than 35 inches would be ideal for women, and anything less than 40 inches would be ideal for men.
And that's something you can do at home.
You can. If you have a tape measure, you can easily do that at home.
Mm-hmm.
And so, if you're measuring your waist, I usually do 2 different measurements with my clients because sometimes it's hard to tell exactly where your waist is, but technically it's the smallest part between the bottom of your rib cage and your hip bone. And so wherever that is, some people have higher waist, some people have lower waist. And then I also measure right around the belly button. And I like for both of those to be less than the 35 for women and 40 for men. So if you're doing it, I recommend doing 2 measurements there just so you can see where you are, because some people carry a little bit more low on their waist and other people a little bit higher, so it gives it a little more accurate. And then if the calculation that Alex gave made your head spin because you're not into math, there are online calculators for BMI. So with that, we use those actually. We're not going to calculate that out. So you can get on there and see. A lot of the predictors for body fat percent aren't going to be very accurate online. So the 7 site skin fold, like she said, which we can do those in a 15-minute appointment here, are pretty accurate if you don't have any idea. It's good to know where you are. So know what your health risk is as far as your body weight. Alex talked about that. Now Sarah's going to talk about how do you know about diabetes.
Yes, and it's interesting that I was going to talk about this too, because I had a family member recently that got technically a pre-diabetic diagnosis and had no idea what that meant. There was no education provided, there was no lab value, range reference, and it kind of irritated me because in that particular family member, that's a serious thing to consider. And now that we know that may increase your risk for COVID, and that is someone who is nervous about getting COVID, doesn't want to be hospitalized. That's be an advocate for yourself. Educate yourself so you understand what these diagnoses mean and what exactly characterizes that diagnosis. So if you're someone who is borderline pre-diabetic, or diabetic, these are the numbers that we want you to be aware of. And so first and foremost, and this is probably the thing that is used for a lot of diabetes management the most, is your hemoglobin A1C. So if you are someone who is diabetic or know someone who's diabetic, that probably is a familiar term. If you don't know what that is, it's your glycated hemoglobin, and it's just a measure of the average percentage of your blood cells that are coated with sugar over the last 3 months, which is the half-life of red blood cells. And so if you have a hemoglobin A1C lower than 5.7%, that indicates that you have healthy blood sugar control. If you are considered pre-diabetic, you'd be in the range of 5.7 to 6.4, and anything over 6.4% indicates diabetes. Another thing that's checked too, and if you are someone who has poor blood sugar control, this is something that you should be checking more than one time during the day, is your fasting blood sugar, and even pre and post meal blood sugars too, but those are different reference ranges than these. And so under 100 indicates a healthy fasting blood sugar. 100 to 125 indicates prediabetes, and over 125 indicates diabetes. If those show up on like your lab values that you've gone from the doctor once, wait for your doctor to talk to you about that. If you're hearing this and you're going and looking back on your lab values and none of those diagnoses have been communicated with you, that doesn't mean that you have those diagnoses, but it is important to be aware of those numbers too. And so if you hear something like pre-diabetes or diabetes in relation to information that's being given to you at your doctor's office, this is what we're talking about in terms of the lab values that are criteria for those diagnoses. I had to go on a little rant there because that was frustrating that my family member went through that.
Yeah. So it is frustrating whenever you get that pre-diabetes diagnosis and you maybe aren't really sure what to do at that point. A lot of people don't know that that's the time they really need to take action and get on it with getting healthier, weight loss if you need to, and eating healthier to control your blood sugar. And a lot of times people know they're going to go get that fasting blood sugar test, and so maybe you'll eat really, really well for a few days and you can help your fasting blood sugar come down, but the hemoglobin A1C doesn't lie. It's kind of like, I've seen this analogy, which I think is a really good one. You have a one game score that you look at for a team versus the whole season. You really get a better indication of how good that team is if you look at the whole season instead of one game.
I like that. That's so fun.
Yeah. So it's a really good analogy.
Sports dietitian.
Yes. Yeah. So, but hemoglobin A1C, thank you for explaining that, Sarah, because it's a really useful test, and it's one of those things that a lot of people don't understand. So, so that's an easy way for you to think about it. So hypertension, that's another one, and this is called the silent killer a lot of times because a lot of people don't feel bad. They don't know that they have high blood pressure, and they call that hypertension. But if you go into the doctor, a lot of times people think that maybe their blood pressure is just high because they're at the doctor, and that may be the case, but you can get your blood pressure taken at a lot of different places, so you may want to try again. But if it is high, don't just ignore it, and if it's less than 120 over 80, that's considered healthy. If it's 120 over 120 to 129 over 80, that's elevated. And if it's 130 to 139 or higher, over 80 to 89 or higher, that's hypertension. And so that's something that you need to be aware of, and that can cause that chronic inflammation and stress to your system, and you may not know until it's too late. So if you haven't been to the doctor in 5 years, for example, and you aren't really sure where you are, you need to be sure that you're getting that checked somewhere. And some of this with COVID, people have been scared to go to the doctor for their regular checkups, and so because they don't want to go get exposed. And so that's another thing that we really want to make sure that everyone understands is that, while you're staying safe, you still need to be proactive about your health, because that might be the thing that saves your life if you do get sick. So don't just ignore your health during this whole time and stay home and don't think about anything. You want to be sure that you know where you are. Next is vitamin D. A lot of people don't know what their vitamin D status is, so I highly recommend that you ask for this lab whenever you go to the doctor. And there are independent lab companies that you can go to here in Springfield. They have Any Lab Test Now. That's a national chain. You can go get these things tested. Typically, insurance won't cover that. You can pay for it, but it's good. It's a good, again, thing to know. You can ask your doctor to order it for you as well, and typically, insurance would cover it for that. But if you look at your vitamin D number, severe deficiency is less than 12 nanograms per milliliter. Deficient is less than 20 nanograms per milliliter. Insufficient is 20 to 29, and normal is 30 to 50. So, and you want to be in that normal range. Again, we have seen that being higher than normal can be a negative as well. So you want to be right in that 30 to 50. And if you haven't ever had that tested or don't know, and all of a sudden you just dump a bunch of vitamin D in, that may not be the best thing for you. If you're low, you definitely need to do a supplement, which we'll talk about that, what to do about it here shortly. So if you aren't at a healthy weight, which what Alex talked about, or a body fat percent, or your waist circumference is too high, if you're pre-diabetic or diabetic, if you have high blood pressure or are vitamin D deficient, you can do something about it. So that's what we'll talk about next. Woohoo! So first you need to know those things. So if you don't know, that would be our first course of action, is go find out where are you. And then if you do know that you have issues in any of those areas, we'll talk a little bit about what we can do. And Alex is going to talk a little bit about nutrition.
Yes. So these are modifiable things that we can do, things that we can change, and things that we can control. And eating healthy most of the time. Imagine that.
Yes.
Just eat healthy most of the time. It's great. Eating mostly fruits and vegetables, whole foods instead of processed foods, and foods high in sugar or refined carbs, we want to decrease those. Just really focusing on half your plate fruits and veggies. You've probably heard us say that in every single podcast. But really focusing on that, what kind of ingredients you're having, which we have a podcast on that from last week, and just making sure that you're focusing on those whole real foods. Whenever you go to the store, loading up on lots of fruits and veggies first, trying to stay out of the middle aisles unless you have it on your list, those types of things. Next would be choose water or plain coffee or tea instead of sugary beverages. It does add up quick, and you're drinking it, so you don't really notice it right away with how much sugar that you're actually consuming. If you're getting like the venti mocha frap at Starbucks, yes, it's delicious, but it's also very high in sugar. So really focusing on water, plain coffee, and tea would be good options. And then decreasing portions, again, filling up half your plate fruits and veggies, eating smaller amounts of high calorie foods, and if you fill your plate up with lots of those whole foods, you have less room for other things. And also using smaller plates too. If you've not tried that, if you feel like you overdo it on your portions, try using smaller plates. That typically helps a lot. Having healthy protein sources such as fish, eggs, poultry, and veggies, and healthy fats such as olive oil, avocados, nuts, seeds at each of your meals and snacks to help keep you more full is important. If you feel like you're getting hungry very often, your timing might be off, or your portions might be off, or maybe you're a little bit low in your protein and fat to help keep you full. So that would be something to double check. And then track your food in a food diary or an app to see if you see any trends and make small changes from there that can make big results. Sometimes we have clients who they feel like they're doing all the right things, but they can't figure out exactly why they're not seeing the results they want to see. And then we'll actually have people track things in apps like MyFitnessPal, the Lose It app. And then you can definitely see maybe something little that you're doing every day is adding up. And if we make that change, it would make a big result.
Yes, very, very well said. So lots of things on the nutrition front that you can do. That's a big one, and that's what we dedicated our whole lives to help people do. And so, and we go into a lot of the research behind those things that Alex just said in a lot of our other podcasts. We aren't going to go into all that today, but now Sarah will talk about exercise.
Yes, we are exercise professionals as well, so we get to talk about both. Yay. I think they go hand in hand. I'm sure y'all do too. So try and exercise consistently if you can. If it's not a part of your daily or weekly routine, just make small steps to eventually incorporate exercise as a part of your weekly routine. And so what we recommend and what the American College of Sports Medicine recommends is at least 150 minutes of cardiovascular exercise per week. And if you want to gain even more benefit, or say you're easily achieving 150 minutes and you're stagnant in your weight loss or your healthy lifestyle journey, incorporating 300 minutes gives even more benefit. And specifically for weight loss too, and for a lot of these diseases that we mentioned, diabetes, prediabetes, hypertension, even just like a 5 to 7% weight loss, research shows can help get you in the right direction of having less symptoms, or even like reversing some of the things as well too, less medication and all of that. So, and then additionally, if you are exercising with cardiovascular exercise, try and add in at least 2 days of strength training as well. You could do an upper body day, a lower body day. If you like resistance training over cardiovascular training, then try and balance that out to where that fits your schedule appropriately. We all love strength training and we all love cardiovascular training, so we have to do that on a weekly basis
Most
too.
of the time.
Most of the time. All right, let's be honest. No. And then additionally, manage stress. So a lot of people that have research shows that have these chronic diseases or live really busy lives, are a part of working corporate America, y'all got really high stress levels. And so managing your stress can do nothing but help you. And that is a lot easier said than it is done. And sometimes it's important to seek out the help of a professional if you need to, therapists, counselors, whatever floats your boat in terms of helping you manage your stress, but also try to engage in activities that help decrease anxiety, keep you calm. You can do things like breathing techniques, meditation, prayer, yoga. Exercise can help manage stress, and just doing things that you enjoy. There's so many apps, YouTube videos out there that are at the tip of our fingers to access ways to help manage your stress. So use that to your advantage. And then the last thing that I'll mention too is to get adequate sleep. I think this is something that all of us in here can probably improve on too, but that's all right. We're working on it. And so for adults, it's recommended to get 7 to 9 hours each night. I like 9 hours. I function better, but that doesn't happen usually. And then, try and participate in a healthy bedtime routine. Try and limit your screen time. Sometimes that blue light from screens can affect how quickly you fall asleep, and even the efficiency and the quality of your sleep too. And trying, go to bed and wake up at consistent times. Having a routine and a schedule can definitely be beneficial in helping you get the sleep that you need.
Yes, so lots of good practical tips there. So, and next, getting help if you need it. So I mentioned before the regular checkups from your doctor. Make sure that you know what your risks are, and develop a treatment plan with your physician. If you have questions about nutrition-related labs, supplements, things on that side, we are experts in that area, and we can help with that as well. A lot of times, if the doctor's busy and you maybe don't ask all the questions. I know I get home all the time and think, oh, I should have asked that. Those are things that we do in our free consultation with people. If you want to come in and just have us look over those things, if it's nutrition related, those are questions that we can answer for you. So also dietitians can be helpful. And trainers, exercise professionals can also be helpful. If you don't know what to do, sometimes that's an issue. You can look online, you can talk to exercise or nutrition professionals. If you need accountability, if you need someone to help just motivate you and keep you going, that's something that we do for a lot of people as well. And so admitting that, okay, I know this is a priority, but I keep putting it on the back burner. So what do I need to do to make this happen? Sometimes that is hiring somebody to help you. And again, we're hopefully helping you realize that this does need to be a high priority. You're never going to have the time. You may not have the motivation, all of those things, the stress in your life, a lot of those things you can't change, but what you can change is making it that top priority and really committing to it. And that's what we really want to help you do. So also making sure you're getting adequate vitamin D. A lot of people don't know what foods have vitamin D, so because it's not talked about. So and really it's pretty limited, especially with foods that people eat often. And so but things like oily fish like salmon has vitamin D. So salmon is great for lots of things. But if you don't like fish, then that may not be an option for you. Mushrooms are a great source of vitamin D as well if you like those. We can get some good mushrooms here in the Ozarks, so mushrooms are a good option. So a lot of people think that they don't have any benefit, but they actually do. So you can throw them in there. They have fiber and other things. And then fortified milks is another one, and that's probably one of the most common ones that people might have on a daily basis. So not all milks have them, and then dairy milk is more common. But if you look at maybe if you drink almond milk or other types of milks, you can look and see if it has vitamin D. Yogurts don't always have them either, so you can look on the label and see if it says vitamin D, vitamin D3 on there. Also on the label, you can see if it has a percentage of vitamin D on the label, like 25% of the daily value of vitamin D. That might be on the label as well, so that's a way to tell. But don't just assume because it is a dairy product that it has it, because they do have to add it in there and fortify it with vitamin D. The other thing you can do is get outdoors. And this is another thing that with the pandemic, a lot of people kind of sheltered in place and stayed indoors a lot. Some people have gotten out and gotten more active, which has been good because outside is a safer place for a lot of people to be. But sunlight helps your body produce vitamin D. And so that's something that, I'm married to a dermatologist, so I have to also say that
you see me sunburned way too many times.
So you also have to make sure that you're not getting too much sun. But some sun is good. And so that's something to think about. 30 minutes 3 times a week with your head, neck, arms, those kinds of things exposed. You don't want to be out there in long sleeves and a hat. That's not going to help. So but while that is good for skin production, you want to get just a little bit of sun. And a lot of times if you're in in the summer especially, you might just going to and from your car, go and those kinds of things, running errands, you will get plenty of sun exposure. If you put a lot of sunscreen on all the time, then that does block that vitamin D production. That doesn't mean you don't get enough vitamin D. And again, these are things that you can do if your vitamin D is low. So you have to look at your risks and benefits there. If you've had a melanoma or just skin cancer, then that would not be something that we would recommend for you to add as more sun exposure. So just be sure you know what your risks are, and really just know what your vitamin D is, like we said, and see if you need to do some things to improve it. Take a supplement if you don't get enough vitamin D from your diet, and you can, if you use things like MyFitnessPal or some of those apps, it can tell you how much vitamin D you're getting in your day, or you can calculate it again because you won't get it from a lot of sources. But children should get 400 IUs, adults should get 600 IUs, and people over 70 should get 800 IUs. And so that's how much you need every day. And again, a lot of people don't get enough, so a supplement might be warranted. If you're deficient, so say you go in and yours is under 20, for example, then a regular vitamin that is 600 IUs for an adult, for example, is probably not going to be enough to get you out of that deficient state. So we would actually recommend more, and a lot of the amount depends on how deficient you are. So so I don't want to give any recommendations there, but it might be a 50,000 dose once a week for a bit, and then once a month after that. So some people who are a little bit low, maybe insufficient, might do 1,000 to 2,000 IUs a day. But if you're taking 5,000 IUs a day and you have no idea what your vitamin D is, then that may not be the best choice for you. Vitamin D is a fat-soluble vitamin, so unlike like B12 or other things, you don't just pee it out if you get too much. It can actually cause some damage, and it can be toxic if you get too much of it. So that's something. And then we're still looking at research too. As I was researching this podcast, there's research out there with people who are really deficient when they go into the hospital, giving high doses of vitamin D in the hospital, having better outcomes. So these are things we're learning about, but be sure to check with your doctor, and if you know what your vitamin D is, you might be able to get that up before you get sick, or to help you if you do get sick. So lots of good, like I said, practical tips today with things to do. We touched on a lot of different things. We probably could have done a podcast on each of those topics individually, which we will do probably many of those. But all of, just reminding you, all of the research that we talked about today really showed association and not causation. So we want to make sure that you understand the difference there. Also, a lot of the studies, I try to pull some of the studies with more people in them, but a lot of the studies there were 20 people in this hospital. Well, that is not a very big study, and so while it may have shown some things, it may not have been no controls. It may have been a similar population. It may not have had lots of different people. So and a lot of the studies are retrospective, observational. So we need more prospective, controlled, randomized research that we're getting with this. But again, you don't have to wait until we know all this. To me, there's enough data out there that shows those pretty significant associations, and all the stuff we recommended today is good for you anyways. So it's not like we're recommending that you do any of this stuff, but just be aware that if you are seeing recommendations for taking these high doses of things, or these and you really don't know where you are, maybe start with that first. And the bottom line is that being healthy is shown to be associated with a lower risk of dying if you get sick with COVID. There are so many things that we can't control right now, but don't let that make you feel fearful, and so that you're not taking good care of yourself and you're just kind of hiding inside. So be sure that you turn that fear into action and say, okay, this is scary. This is a scary time. Lots of things we can't control, but what can I do? And I really want, like I said, this to be a big call to action to say, okay, we can do a lot of things. You can control how sick you might get if you get it, whereas you may not be able to control if you do get it 100% of the time. So my big thing is, what are you waiting for? Let's go.
Yeah, let's do it.
Let's do this. I just got up for those that did.
So thank you so much for joining us, and we hope again that this gives you some things to consider, so that you maybe feel like there is something that you can do during this time, and you go learn about your health, and if you have any issues, you do something about them. And small things, small steps, there are lots of things that you can do out there that would be realistic for you. So thank you.
Thanks.
Thank you.
Have a good day.
See ya.